ways that you might be taking zinc all wrong. Guys, I'm Dr. Jen. The first way might surprise you, and that is intranasal zinc. That is zinc by form of nasal spray. This is an important one to keep in mind because actually the FDA issued a warning against certain nasal sprays containing zinc a number of years ago. What they found was that there were a number of people that had lost and developed loss of smell as a result of taking intranasal or nasal spray zinc preparations. In some cases, that loss of smell was permanent. That's right. Could be temporary, but also could be permanent. There was an FDA warning issued about this years ago. For that reason, as a family doctor, I would not recommend my patients take intranasal zinc, okay? That is the first thing. I'm not your doctor. Check with your doctor, but this is my opinion. Number two, the other way that people are taking zinc all wrong. Oh, and by the way, before I tell you this, I'm going to tell you in this video what the importance of zinc is, where we get zinc from, and the people who are most likely to need zinc supplementation. It's not exactly who you think. All right, so back to the second reason. Rather, the second thing. Second way you're taking zinc all wrong is you may be taking too high of doses. I have said this before, but many vitamins and supplements and minerals can be taken in doses that are too high, which can cause toxic levels in your body. In the case of zinc, and by the way, this is according to the NIH. The NIH says this amount. They say at doses of 50 milligrams or more for weeks, that's what they give. But I'll caution you and say, don't just go by that number because I think different people could have different toxic levels. But at too high of levels of zinc for too long, it can actually cause a copper deficiency. This is why we say everything in moderation and that you should not just be treating yourself willy-nilly. The other thing is, too much zinc can cause decreased levels of magnesium in your body, can also cause decreased immune function and decreased HDL or good cholesterol levels. Not only that, but too much zinc can cause things like nausea, vomiting, dizziness, headaches, stomach pains, and you name it. So there are many different ways you can get zinc wrong. Two of them are by taking too much, and the second, in my opinion, is by taking it intranasally or via nasal spray. But this is the thing. Most of my patients who ask me about zinc, I don't feel that they need zinc supplementation. We know that the studies, well, I'm actually not going to tell you about the studies for zinc for colds, because if you'd like to learn more about that, I will link a video here. I have a whole video on whether zinc actually helps colds. But this is the thing. Most people are not going to be zinc deficient. Where do we get zinc from? We get it from our diet. It's in fish, seafood, meat. There's a high level of zinc in oysters, in beef, and eggs, and dairy, and so many more things. Many breakfast cereals are fortified with zinc, which is a good thing. So many and most of us are not going to be deficient in zinc, okay? Now, it is true that zinc is so important to our body, right? What does zinc do? Well, it plays a role in our immune function and our immune system, right? It plays a role in protein and DNA synthesis, wound healing, cell division, even our sense of taste, right? Growth and development, so many things. But once again, not everyone, most people will not need to take zinc. Now, who is at highest risk for having a zinc deficiency? Well, those include people who may be vegetarians or vegans who don't get sort of that full range of diet, okay? Also, people who have inflammatory bowel disease, things like Crohn's and colitis, ulcerative colitis and things like that. Maybe pregnant or lactating women, young children with certain risk factors, people who drink lots of alcohol, children with sickle cell disease, and other people. And I'm not saying that zinc is not or should not be used as a treatment. Yes, we as doctors may treat patients who need to be treated with zinc. What I'm saying is before you go out and buy zinc thinking that it's just a good idea to take, you need to check in with your doctor to see if they even think you need it, because there are risks to taking too much and taking it the wrong way. Let me know in the comments. Do you take zinc? Why do you take zinc? I'm Dr. Jen Caudle, practicing family physician. Good to see you. Subscribe to my channel on YouTube. Follow my page on Facebook. I'm on Instagram, TikTok, LinkedIn, What's In. Follow me there and go to my website, Dr. Jen Caudle, to sign up for my free health newsletter. Guys, I'm Dr. Jen.